Well, maybe Jody, if you can start just a little bit, you're going to be new to some. This is our first time being able to host you, and you'll be new to some of our community.
Yeah.
Maybe if you can just kind of give an overview of your, experience with ISTDP, your connection to Dr. Davanloo, and just a brief kind of take on maybe the experience you've had, learning and training from him.
So let me take a huge step back. So
Yeah.
my first exposure to Dr. Davanloo was I was working as a chaplain or a teaching chaplain in a psychiatric hospital, and my experience of patients is that people actually liked when they were engaged, right? When people really wrestled with them. That was my experience. And we worked in palliative care. My experience in working with dying patients was people liked it when we were alive, when we were talking more dramatically. So I kind
Mm,
of had that orientation. That's what I was teaching my students. And then one day I was doing a course on I was doing a lecture on working with spirituality and depression, and a psychiatrist was working with me in Feltham, and I was saying a lot of people who say they're depressed aren't depressed. In fact, they're angry or they're feeling a lot of guilt or grief in their lives, right? So he was intrigued by that, and he said he agreed with me. And he at the time was working with Dr. Davanloo, and he
wow.
said, you should meet Dr. Davanloo. And he was being under supervision with Dr. Davanloo. And so he and a group of other people invited Dr. Davanloo to come to Halifax. And I hosted them. I hosted Dr. Davanloo on our campus at Atlantic School of Theology. So that was my first exposure to him. And I was just blown away, first of all, by this stuff, right? Like, wow, this is really. I was pretty assertive with patients. I mean, he was off the rails, right? Like and I'm going, wow. But I was seeing results. I thought that was really intriguing. And it was shortly after that that because of that connection that he invited me to come to Montreal for supervision. So from 2002 until about 2007, I go to Montreal 4 or 5 times a year in the classical supervisory protocols,
Mm.
and we sit there for I'd review tape and blah blah blah, and he just Dr. Clarke this and Dr. Clarke that, and he just reiterate what I wasn't doing properly, right? And but he did that for everybody. So we did this for a week, right? Kind of classical supervision. And none of us could say anything. And we just sit there and listen and watch tapes and doodle and fall asleep and snore and stuff while, because some of it was just not good. And at some point, Dr. Davenley realized that the problem wasn't with the patient, it was with the therapist.
Right.
It's the therapist that was, bringing the patient just so far, but couldn't go further because of something in their unconscious that was inhibiting their ability. So he
Mm.
recognized the importance for therapists to become more fluid. And
Hmm.
that's really how he invented or developed the Montreal process of us coming together, a group of about 14, 15 therapists, and for 4 or 5 times a year for about a week, from 9 o'clock in the morning till sometimes 7 o'clock at night, just interviewing each other and
Wow.
reviewing the tapes and interviewing each other, and really allowing the whole group to become more fluid,
Mhm.
to work in our technique. We're practicing and practicing and practicing. But the other thing, we're spending enormous amounts of time living in the unconscious of our colleagues and by virtue of proximity ourselves, right?
Mhm.
Wow.
So just becoming really familiar and seeped. So from 2008, he started in 2007, but because of my own resistance, I didn't join the 2007 cohort. So no, 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 right? Like I didn't want to do that. Or partly, like yeah, I was scared. So because
Yeah.
he in 2007 he ran two groups. He ran the supervisor group, the classical group. I stayed there. It was safer. And then the other group, like Kate Hickey, for example, who wrote a really great book about it, she was a part of that 2007 group. But in 2008, you either jumped on board or you jumped off. So I jumped
Mm.
on board and I was invited to jump on board, which was a great experience. And then, so 4 or 5 times a year, we go to Montreal and Green Street, and then eventually moved it to the Cantley. But, and that's what we did for from 2008 until February of 2020.
Yeah.
Yeah.
So it was really rich, and people would come and go depending on what was going on in their lives. Not everyone.
Mhm.
I made most of them. I didn't make all of them, but I made most of them,
Mhm.
Hmm. Hmm.
and it was such an extraordinary experience.
Wow.
Mm.
Wow. Did you feel like in that, because really that's the latest stage of his
Yeah.
development of
Yeah.
thinking, and and I'm sure he
Right.
learned a lot about from the Montreal experience and those
Yes.
kinds of things. Did you see much kind of development in his thinking over those, final stages of his life? Any change, or did it feel like no, he had discovered how things work, and now it was just a matter of kind of getting it into the therapist's unconscious and
Mm,
that kind of thing?
No, I think he discovered a lot of other things, and I think
mhm,
that's a tragedy. That's why, like, Angela Smith's book is really important. Fusion and Diffusion, Notes on the Montreal Experience,
Yeah.
for understanding how the punitive superego works
mm,
and the need to eradicate that, destructive competitiveness, projective anxiety, the perpetrator of the unconscious. These are things he was talking about beforehand. You saw some of this in some of his earlier things, but here he's really refining it and
mm,
watching how it operates.
Hmm.
Um, and we're all watching it too because it's in us. Like I have destructive competitiveness in my unconscious. My punitive superego ego has much less control now than it once did. So it's our ability to and really I mean, believe it or not, to try to eradicate that from people's lives. He would
mhm.
say, there are a few tapes where he'd say, Dr. Clarke, this should be eliminated from your life.
Hmm.
You think, how can this thing that's controlled me for such a long time be extinguished?
Mhm, mhm.
But why not try? Like, why would you want to
Yeah.
stay captive to it?
Right.
So I think the refining of it was one of the gifts that we all experienced. And I think the other thing was just spending so much time. He referred to the unconscious as a vast ocean and
Mm,
not becoming anxious. So, as therapists, and Tammy, you pointed this out earlier, if we're not anxious, like I treat a number of therapists, as you
yeah.
probably know, and
Yeah.
they're all anxious, right? They're all anxious about seeing patients or all, which is good. I'm glad they're anxious. They should be, right? Because it's scary stuff. If you're not anxious, you
Sure.
should be.
Yeah.
But it's not allowing the anxiety to control us. To
Exactly.
when there's been a breakthrough and they're not locked on, you think, oh, this should be like they should see the eyes right away, right? Well, they don't
Hmm.
see the eyes right away. That's okay. I've seen this 1,000 times. We're patient.
Yeah.
Just what do you see? What do you
Hmm.
see? And then they see the father's eyes or the mother's eyes and the grandmother's eyes or the
Mm,
uncle's eyes. And then you have this massive movement of guilt-laden feelings, right?
Yeah.
The other thing
Yeah.
I think that was really big, and this is the family tomb issue, is we were able to excavate our family tombs in new ways and
mm,
realize the importance of that. And
mm.
I've done a lot of that excavating myself with some of my colleagues. And that's just such a liberating piece when we can reclaim relationships and have
Yes.
empathy for these people in our lives who, even if they're abusive, physically or emotionally, um, that we can see them very differently. And they're no longer controlling us, or our reactions aren't controlling us. So to see the
Exactly.
longitudinal movement in people and ourselves over time is really remarkable.
Hmm.
Is that
Hmm.
helpful?
Yeah,
Yeah.
very much so.
Yeah. Yeah.
Yeah. And yeah, just for time's sake, we are so excited to host Dr. Jody Clarke and to have you on September 5th and 6th, 7 a.m. to 3 p.m. Pacific Standard Time, 10 to 6 Eastern Standard Time. And Jody, yeah, maybe just your final thoughts on, I know that you're going to be talking about working in the transference and how important that is and helping equip therapists to learn how to do that, when to do that, how to do that, and then a little bit more about the Montreal experience, like that's on the second day. So if you could just share a little bit about your heart on your intention for day one and working in the transference with high resistant and super, you know, punitive ego, and then the Montreal experience.
Uh, one of the big, I think one of the difficult things for trainees and for all of us is to move from what we often call classically the C or the incident, or, my mother's really bothering me, my husband's really bothering me,
Right,
and to bring it into the room, right? So the beauty of so making that shift into what's going on right now, because we could talk about those things till the cows come home, right? Seriously.
right,
And there may be some relief of symptoms, some minor relief, but it doesn't get at the why is that being driven up into their conscious? How is it affecting how they function, right? And so every movement that the therapist makes toward closeness and intimacy will activate something in the unconscious of the patient, right?
Hmm.
So as that comes and you begin to see a resistance crystallizing in that relationship, we can now pivot to what's happening right here because we can control that. We can see that. That's an actual. So day one, part one is that people can begin to see that struggle in that relationship, in that room, in that
Yeah.
moment. It's, I'll sometimes name the date and the minute that we're in this moment right now.
Hmm.
It's right in the stake in the heart of this right now. And do you
Mm,
want to continue these destructive patterns or you want to, it's up to you. And
right.
it's really up to you. It's totally up to the patient. That's the other thing I like about this therapy. It's, I would love the patient to be liberated, but if they don't want to be, I can't do anything about that, right? I can
Right.
give them the very best. So
Hmm.
at that moment, then coming into the transference is so pivotal because now you're wrestling eye to eye with another human being. How do you feel here toward me? What's going on here right now? Well, let's
Mhm.
see what's going on right now here toward me. And the other thing that that does is it gets us rid of the C. The C is conscious, but
Right.
the T is unconscious,
Mm.
right? So it's
Hmm.
moving to that unconscious material because it's not always what we think it's going to be. The brain, all the ego material will flood us, and we think we know what the truth is, but we don't know what the truth is. And this is about truth.
Mm-hmm.
Conscious, believe it or not. Freud kind of had it mixed up. He talked about the id as this amorphous, horrible thing. And yet the id, that unconscious material, the deep material that looks punitive, destructive, actually has an honesty and integrity that we need
Hmm.
that will be the source of the liberation for the patient. So
Wow.
for us to move into this to the T, work in the T, keep it stayed focused on the T, we will get to that material. If we
Hmm.
stay in the C, you might be lucky to get close to it. But I don't want luck. I want
Right.
clinical data that you can point to, right? Say this is really good. Is that helpful?
That's
Yeah.
great. Yeah, I love that. And I think that's going to be deeply important of yeah, working in the transference. And I love what you're saying. In the C it's more conscious because that's true. And the T is
Yeah.
like you were saying earlier, Jody, the unconscious is the vast of the ocean inside of each of us.
Yeah.
Right. And then with the Montreal experience, and what I love when Matt and I initially reached out to you about hosting you, like, what really struck for me is your dedication, Dr. Davanloo's dedication, all of our dedication to for the therapists, right, to be unblocked, undefended, less anxious, and more fluid in our own
Right.
unconsciouses. And that's exactly what the Montreal experience kind of intention was born out of that, along what you were saying with Matt's question about Dr. Davanloo refining, the evolution of working in the unconscious. So, yeah, any final words on what I'm
Well,
saying to
I
you?
love what you just said, Tanya, because the really interesting thing about that is that if we're more fluid,
Mhm.
we'll actually have a huge impact on the unconscious of the patient, right?
Hmm.
In other
Mm-hmm.
words,
Mm-hmm.
because we're not resistant to because we're able to corral, neutralize, or even get rid of our own anxieties about closeness and about intimacy. And if the unconscious of the patient picks that up, then there two things happen. A, you get a faster rise because we're a bigger threat, right? Which is good. There's nothing wrong with that. But secondly, they can kind of rest in the fact that your unconscious doesn't get anxious, right?
Exactly.
Hmm.
It's
So
Right.
like
yeah, when they say, "Look, I feel warm feelings towards you, erotic feelings towards you, I want to rip your heart out," that we're not getting, "Oh, geez, don't talk like that," or they want to, like it doesn't cause us anxiety because we know where it's going.
Yeah.
exactly.
Yeah.
And
So
that
I
is so
think that's
deeply
big.
important.
Yeah, because this is Dr. Davenant would say consistently, it's about love, it's about closeness, it's about fluidity, it's about intimacy, it's about
Hmm.
kindness. And one of the big myths about ISTDP that I find difficult, and people say, "Oh, it's all about anger, it's all about aggression, it's all about violence." And I go, "No, actually, that's what you're doing to yourself all the time."
Hmm.
Trying to get rid of that. That's what we're trying to do, right? So
Oh,
because you don't need to be violent. You don't yeah, you're getting this thing out, and yeah, it is violent, but look at what it's doing to your life, right?
yeah. Yeah.
You don't.
Punching me out, slitting my throat, eviscerating me, that's nothing compared to the way it's affecting you,
Day to day.
yeah,
Yeah.
Exactly.
exactly.
Yeah. 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 Yeah.
Yeah.
So give our audience and prospective attendees just a little, what's this Montreal experience? What are you going to be doing to us, Jody?
Well,
What's
what I'd like you to do for the last part of our day too, we're just going to
yeah,
have a couple of people willing to be interviewers and interviewees, just to see how it goes. You don't have to. It was sort of a phase of inquiry, setting the covenant. What do you want to work on? Just begin to talk. By the end of our day too, we should have a little bit of fluidity in the group. Hopefully, you will watch videos. We'll have conversation, and we'll have a chance to chat, and then we'll just have a chance to do a little bit of interviewing, much like we did in Montreal. Not extensive, just a little bit, and we'll do maybe two or three depending on time, and then we'll debrief it. So
Mhm.
everyone, and don't worry, like I'll support you, so for the person who's the interviewer or the interviewee, and
Yep.
we're just beginning to do that, and then we'll be interested in your experience, what you felt, what you thought, whether you're brand new to ISTDP or you've been doing this for 1,000 years, just to
Mhm.
have a little bit of conversation to see what the benefits. I also want to demythologize it again. People go, oh,
yeah,
well, is it ethical? Is it this? Is it that? Or, what is the kind of secret society? Yeah, we
right.
have a secret handshake.
Will you be teaching us the secret
I'll
handshake?
say
That's what
secret
comes
handshake.
with the registration fee is
Exactly.
right,
And but
right,
it's not a secret. Like it's not meant to be a secret. It's just really meant to be. I think it has huge pedagogical implications if we
right, right,
begin to
right, right.
think about it or want to do it. I think Dr. Davanloo was, if we look at ISTDP generically, it's such a brilliant idea. And then he just kept till his dying breath. He's still pushing, exploring, examining. It's such a
Right.
wonderful model of compassion and kindness for a world,
Yeah,
right? It's all about kindness. It's all about love, and
yeah,
people freeing themselves so they can be more intimate with people, more genuine with people, less defended. You
yeah,
know, it doesn't it doesn't mean that we walk around naked. It means that we're walking around with confidence and a strength and a capacity that allows us to have access to the full panorama of our emotions. So we can
yeah,
say to somebody that did something wrong, I don't like that behavior,
Right.
or we choose to say, well, no, I'll turn the other cheek. I'll do something. Uh, it gives us dexterity.
yeah,
So yeah,
Yeah. It's a very honest and
yeah,
inviting honesty, right? With all of our emotions. That's
Mhm.
yeah.
wonderful.
Yeah,
And what a gift he gave to us, gave to you guys, and then what a gift that you're going to be then kind of passing on his legacy, especially for those of us who weren't able to learn directly from
Mhm.
him,
Right.
and for those of us who are interested in teaching and training, this being, a massive innovation in terms of how we teach and train therapists to kind of embody this model. So I think that's
Yes.
going to be a great offering for our attendees as well.
Yeah.
So,
Yeah. We're so excited.
Well, I'm
woo!
looking forward to what I'm going to learn, right? Like this is going to be fun. I hope to learn a lot from it. So
Yeah.
it's to be community with each other. So yeah,
Yeah, yeah,
cool.
that's great. Well, we can't wait. Yeah, can't
I
wait
can't
for
wait.
it. It's gonna be awesome.
Good.
Yeah, great.
Thank you.
Awesome. Thank you so much, Jody.
Tammy,
Okay,
you're welcome. Matt, you're really welcome. It's a pleasure working with you too. So I'm
we'll
excited.
we'll
Yeah.
see you on September 5th.